housekeeping matters. We are recording this town hall. There will be a copy of the recording available later for people who weren't able to make it at this time. There's also closed captioning available for anyone who needs it. There's a button at the bottom of your screen that you should see. You can press on that to start the closed captioning. Also, we have turned off your video and your microphone for this, so the panelists can neither see nor hear you. And you will only see the panelists who are speaking. After the panelists have presented, we'll have a question and answer period. You can continue to submit questions by clicking on the Q&A. We've disabled, for security reasons, we've disabled the chat, so you don't have the ability to see the questions that other people are posing. I'll try to sort through those questions. We may not be able to answer them all during this time period, but we will collect those questions and we'll try to provide answers to everything that's presented to us at a later time in an email that we'll push out to everyone. So with that, I will turn it over to the Chief Justice.
Thank you, Gail, and thanks everyone for joining the video call today. We wanted to share with you our plans for gradually and safely increasing judicial operations as the governor lifts restrictions on public activity in Delaware. Before we get into our presentation, I want to start by thanking you for your patience and understanding as COVID-19 has forced us to limit court operations to essential services. We know that has caused financial hardship for the public who needed access to judicial facilities, for the judicial branch employees who had to leave their offices, for the lawyers who could not pursue their cases, and for their clients who wait for their day in court. Not only has there been financial hardship, but we know there has been personal heartbreak too. Hundreds of Delawareans have died from the virus. One of those numbers on the daily charts was my mother-in-law. Hundreds are still hospitalized and thousands have been infected and sick. We're all quarantine weary and longing for the return of some normalcy and closer contact with family and friends. With all the bad news, we need a little light at the end of the tunnel, and today we hope to provide some of that light and are optimistic that better days are ahead for the Delaware judiciary and for those that are part of our family. Not long after we closed our judicial facilities to the public, I created the Courts Reopening Committee, which was staffed with a cross-section of the courts and our justice partners. On the call today are Superior Court Judge William Carpenter, who chaired the committee. As many of you know, Judge Carpenter has served on the Delaware Superior Court with distinction for many years. Judge Carpenter was ably assisted by Gail Lafferty, our state court administrator. And finally, Dr. Alfred Bacon, who is on the call with us today, it was and is the medical advisor to the committee. Dr. Bacon is head of infectious disease associates and has been on the front lines of the COVID-19 pandemic in Delaware. The committee submitted a report to me this week proposing a plan to gradually and safely increase judicial operations. I've accepted their recommendations, and the formal report will be posted on the court's website after the calls today. A new emergency order will also be entered sometime next week, reflecting those recommendations from the committee. What I'd like to do today is we'll start with a COVID-19 Delaware update from Dr. Bacon, and then I'll ask Judge Carpenter to briefly summarize the committee's recommendations. The report is quite lengthy, so Judge Carpenter will just be giving a very 10,000-foot presentation on the various phases that have been recommended for reopening. We'll follow Judge Carpenter with comments from Dr. Bacon to stress health precautions everyone should observe when returning to our judicial facilities. And then we'll have time for questions submitted to Gail Lafferty. Right now, I'd like to turn it over to Dr. Bacon to give us that update on COVID-19 in Delaware.
Thank you, Chief Justice. I appreciate the opportunity to be with you all today and to discuss this disease state. My goal is to review the entity of SARS-CoV-2, the virus, how it presents as an illness, how it's transmitted, a discussion of how prevalent it is in Delaware, and then discuss ways to mitigate risk of acquiring the virus and spreading the virus to your colleagues. You know, I really value the role that you play in this state and this community, and I'm honored to have an opportunity to share my thoughts with you and to help you move back into a way of being that's more conducive to your why you do what you do. So thank you for asking me to participate. SARS-CoV-2 is a virus linked to respiratory syndrome. I'm not going to share with you the epidemiology of its arrival here in the United States, but when it does cause illness, it causes upper respiratory disease typically, shortness of breath, cough, fever, headache. These are all relatively non-specific comments, you'll notice. Nausea, vomiting, and diarrhea. And in the setting of a pandemic, if you were to call me on the phone at night and tell me you had even two of these symptoms or one of these symptoms, because the prevalence is so prominent and a pandemic exists, I would assume you have COVID-19. And that's the purpose of the screening tools used to enter buildings and to determine if people have acquired disease or risk for disease or risk for transmitting disease. A significant amount of the virus may be subclinical. At the same time, if you come in contact with another human with COVID-19, the risk of acquiring it we'll talk about, but the time frame of that risk is about 14 days incubation. Meeting with an individual with COVID acquiring disease is about 5 days on average to develop those symptoms I've described, maximum 14 days. Therefore, if you're in contact with a COVID-19 individual, you need to watch yourself, or someone needs to watch you for 14 days for symptoms. The risk of transmission is probably at its peak when someone's coughing, short of breath, or having fever. I will also tell you that the risk of transmission exists before symptoms arise, perhaps 24 hours, maybe as far as 48 hours before you become ill. And there's a discussion of asymptomatic carriage and asymptomatically passing the virus on. It's a valid discussion. This is why when the state moves toward contact tracing, you'll perhaps be identified as someone who was in contact with someone who was found to have COVID-19. It may have been 5 days, 10 days ago, and they were perfectly healthy when you saw them. They may have become sick the following day. The other question often is, how often or how long am I infectious with this organism? There's relatively good data now that if you acquire disease, have disease, you're sick, once you go through your illness, once the fever has resolved, a 7-day time frame is probably appropriate for considering yourself not infectious. This is a pertinent slide. This virus is transmitted from person to person, much like influenza, but it's not influenza. This slide identifies the fatality rate by age of individuals with COVID-19. I first saw this slide about 2 months ago, and it hasn't changed. The fatality ratio, the fatality rate among age groups is prominent, particularly those over 60 and up into the 80 range, particularly those with diabetes, hypertension, comorbid conditions. This is the vulnerable population you need to watch out for. 14.8% fatality rate in the 80-year-old population. That is 10 times what we see with influenza. All of these numbers, even down to age 10 to 18, is 10 times the fatality rate of influenza. In the state of Delaware last year, between November and into March, there were 13 deaths due to influenza. We've had over 300 deaths due to COVID of the last 8 weeks. The mode of transmission is essentially how this virus gets into your nasopharynx. It's spread by droplet. That's well defined now, not airborne, with a distinction to make. Droplets land on your hand. You touch your face, your mouth, your nose. Droplets are acquired from sitting close to someone when they're breathing on you, and secretions are often passed around, so to speak. The risk of acquisition of the virus from surfaces is debatable. Current data from CDC and from other sites suggest that surface contamination certainly occurs, but if you wash your hands or wear gloves, the risk is minimal. Frankly, I consider surfaces of minimal risk. Never say never, however. So the risk of transmission from one person to the other, it is pertinent. Recent data suggests that up to 40% of transmissions occur from an asymptomatic person to another individual. If you live in a household with someone with COVID-19, you have 11% risk of acquiring disease. If you work closely with someone in contact at work, 4.5%, about half the risk. If you share a meal, the risk may rise to 8%. Meals, there's a lot of hand-mouth action when people are sharing meals. A lot of talk, hand-mouth, a lot of stuff going on there. And meal sharing is a high-risk experience. Anecdotally, in the hospital, I see numbers of families coming in after a Mother's Day brunch or a birthday party. And 2, 3, 4, 5 family members are all hit with the virus, with sometimes variable outcomes. Recent data is very, I think, important in that it expresses the risk of acquiring the virus when you're in non-close contact, when you're out in the world. For example, if you're in a grocery store wearing a mask, 6 feet distancing, you have a less than 0.1% chance of acquiring this virus. You're not going to pick it up from the products or the packaging. If you're the clerk in the grocery store, however, that risk rises to 2% because people are walking past you constantly. If you're outdoors in a well-ventilated area, the risk is clearly less than 0.1%. So what is the prevalence of this virus? How prevalent is this in our community right now? We don't have that firm number. If you look at the data, you'll see that we have 9,000 Delawareans positive for the virus with 900,000 to 1 million population. Is the prevalence 0.9%? No, it's much higher than that. Not much, but it's higher than that. So we've tested 55,000 people in the state of Delaware. 9,000, of course, are positive, as noted. Is the prevalence 17%? No, it's much lower than that. These are often clinically ill individuals, so this is certainly a high-yield population you're testing. The DPH, and I've talked to them a couple times on this, the numbers are dropping clearly and maybe getting below 2%, maybe even as low as 1% in the general population. That's part of the discussion. Testing is fraught with hazard in a lot of ways. I would note that the classic test is the real-time PCR. It detects the RNA of, the gene of the virus in your nasopharynx. They're also doing oropharyngeal swabs as well. And that test depends on where you are in the course of disease. It's a very high yield if you're acutely ill. Antibody testing, which is a topic of great discussion. This is where if you've had an illness, you can test your blood to see you have antibodies in the blood. And those antibodies are proteins to protect you from future infections. The antibody testing for COVID-19 disease is poorly standardized. In the commercial labs, they're throwing out antibody testing to the general population with limited data to support its sensitivity or specificity. I actually am not a fan of antibody testing in any population, but they're using it in some high-risk arenas, extended care facilities, and we're also using antibody testing for the plasma that we're using, the convalescent plasma to infuse in sick patients, to document that plasma is coming from someone who has antibodies. So we don't know the true number of prevalence. We can't document it. We use surrogate markers for that. What are those markers? How do they tell us what the disease is doing in the community? Number one, number of hospitalizations. How many sick humans are going to the hospital? That's a pretty good marker for disease. Maybe the tip of the iceberg of disease, because 80% of people may have mild to moderate symptoms. And then we also use the percent positive of those that are tested. For example, if we test 100,000 people and the percent positive is 5%, then it looks like it's about 5% of that population we've tested. And watch the epidemic curve. The epidemic curve in Delaware is flattening out. Current database in Delaware, there are 200 people hospitalized as of Wednesday, 340 deaths, 9,000 positives, total 55,000 pretty much tested. There is a difference between the the prevalence of disease active in Newcastle County versus Sussex County, 61 per 10,000 positive, 214. It's hard to determine what this is all about. This is the disease of population density. And the obvious marker for that is New York City. Subway cars, dense populations living and working together. I think that's a salient point. I would also comment that I think there's some industries in Lower Delaware where both living and working together is very dense, as well as perhaps a higher population in extended care facilities. And a couple of the extended care facilities in Sussex County really, unfortunately, took on some patients. So the current data in Delaware, current hospitalizations from around 280 2 weeks ago, we're hitting around 160 right now, 130 right now. This was up to 300 at one point in time. New hospital admissions per day, this is per day database, trended over time. Both these are trended over time. As of now, the trend's clearly dropping. this number of 27 hospitalized on May 13th. On April 30th, that number was 130. The additional surrogate markers would be percentage of persons who are tested that are positive. This number obviously is trending downward. This was as high as 25% when they first started testing, because all they were testing were sick people. So as the testing expands, this number will drop. And those, once again, is a surrogate marker for the prevalence in the community dropping to a more acceptable level, and therefore allowing us to open up, so to speak. And then new positive cases per day in the state of Delaware are actually trending downward nicely. From as high as 250, almost 300 a day back in April, now we're down to a number of well under 50 in that range. So that's how this disease affects you. These are the symptoms you need to watch for. This is how you can transmit it. And this is a discussion of how prevalent it is among the people that will be walking through the door in your work environment. I'm going to turn it back over to Chief Justice.
Thank you very much, Dr. Bacon, and thank you again for taking the time out. We know you're at the hospital now. You're spending a lot of long hours there, and we appreciate your time away from your patients to help us today. Judge Carpenter, would you like to take it away, please, and give us an explanation of the report that your committee worked so hard on?
Okay, thank you, Chief Justice. I want to start out by saying that the committee was quite large. We had over 50 members at some point in time who were participating. Some was on the reopening committee, some was on subcommittees that we developed, but every court was involved. Our judicial partners were involved. The Department of Correction was involved. So we believe we have gathered the input from the various partners that we needed to present, we believe, a logical and appropriate approach to reopening the courthouse. Let me start by saying we began the process by looking at what was available from a technical basis in the community. We had the benefit of publications issued by the Center for Disease Control. We had the benefit of the President's Commission on Reopening America. We also had the governor's phasing plan for reopening that they have created. So using these documents as a guide, we first developed some principles that were going to be key to how we were going to manage the reopening of the courthouse. We were going to rely upon medical information and advice that was given to us. We hired Dr. Bacon to be part of the team, and he's been a great assistance in providing us some insight in how to best address these issues. The priority was to minimize the risk to our employees and to you who are coming into the courthouse. And so all actions were taken to try to ensure that we've thought about how to not eliminate, because that's impossible, at least minimize that risk. We also believe we needed to minimize the traffic that's coming into the courthouse and increase our ability and reliance upon technology to handle court calendars. We also talked to the Department of Correction about needing to limit the number of incarcerated individuals who are coming into the courthouse and increasing our capacity at those facilities to do remote appearances. And we recognize that every courthouse is not the same. The courthouse in Sussex is much different than the courthouse here in Newcastle. So we had to develop a structure that was flexible enough to be able to have it apply to each of the courthouses. So that led us to a development of a four-phase plan to slowly and logically reopen the courthouse. Now I'm going to review the phases with you, but in the report itself, which I encourage you to download and read, the actual proceedings that we have identified that could be undertaken in each phase have actually been listed. So I think that will be helpful to the court and to you as we begin to reopen and open more calendars. Now, phase one is really what we're kind of identifying as our soft opening. One of the critical points that we believed in providing some comfort is what was going to happen at the front door of the courthouse. So we decided to have a soft opening, allowing attorneys to come back into the courthouse, bail bondsmen to come back, individuals who are posting bail, and data miners together with the media to allow them to come back into the courthouse first under phase 1. There still is a requirement for 6-foot social distancing and no more than 10 individuals in the courtroom. But it was our opportunity to try to make sure that the screening procedures and the equipment that we were buying for the front of the courthouse is working, whether additional training needs to be undertaken, and make sure that the front facility is secure and has what we need to test individuals coming in. You'll see in phase 1, there's a small increase in the staff from where we are now. But generally, other than allowing you to back into the courthouse to handle matters that you believe, not much will be changing in phase 1.
And Judge Carpenter, what are we targeting for starting phase 1? What date?
We're targeting June 8th as the opening of the courthouse for phase 1. That will mean that the attorneys will be allowed into the courthouse at that point in time. If everything runs smoothly, we have the equipment all set up, things seem to be working well at the entrance of the courthouse, we would move to phase 2 the following week on June 15th. Obviously, if things are not working well, we would delay that, but that is the hope. Phase 1, June 8th, phase 2, June 15th.
Thank you.
Okay, now phase 2, we're actually going to open up the courthouse to the public. So in addition to attorneys, your clients, and others who need to have business in the courthouse will be allowed in. There still will be a requirement of 6-foot social distancing, no more than 10 people in a courtroom or the public areas outside of a courtroom. All the public areas in the courthouse will be closed. We will increase staffing to 50%, and bench trials involving both criminal and civil cases can begin. It's important in this phase that for those who are in the criminal setting, we will not be bringing inmates into the courthouse during this phase. We will still do all of the incarcerated matters by video. But since March or April, we have not been doing any non-incarcerated criminal matters, so those matters now can proceed. You'll note that we've also indicated grand juries going to proceed, that it's anticipated in early June, around the June 8th date, the Kent County will try to impanel a grand jury. It is likely that Newcastle and Sussex will do it around the 22nd, 23rd time frame for a grand jury. In Newcastle County, that's going to require some technology, but we think we have worked those issues out. No jury trials. Obviously, with only 10 people in the courtroom, that would be impossible in this phase. We then go to phase 3. That allows for an increase in the number of people that are allowed in the courtroom to 50. And that will also allow us to begin doing jury trials. There is still 6-foot social distancing in the courtrooms. Public areas will continue to be closed. But the other key part here in phase 3, in addition to jury trials, now incarcerated inmates will be transported to the courthouse. So those calendars that are not going to be handled by video, those inmates will be brought to the courthouse, and their matters can proceed. I've indicated that criminal and civil jury trials can begin here. The report does not set forth in detail how that is going to happen yet, because since we didn't think this was going to be available until phase 3, we wanted to take some extra time and see how other jurisdictions are handling it. Obviously, even with 50 people in a courtroom, it makes it really difficult to pick a jury, particularly a jury of any significance in the type of case that it's in. So a subcommittee of our group is continuing to look at the jury question and how we'll actually perform that task. So 6-foot social distancing and mask face covering will be continued.
And Judge Carpenter, as far as the timing of phase 3, we've left that open, correct? Because we really have to see how we do in phase 2 and track the progress of the virus to see whether we're ready to increase the activity to the amount that we have in phase 3, right?
That is correct. We haven't put a time frame on it. That will be a decision by the Chief Justice in consultation with the other justices and in consultation with Dr. Bacon. We have to be cautious. You can appreciate that over the last 3 or 4 months, schools have closed, daycares have closed, people are scared, people have lots of apprehension about entering back into a society grouping. So we have to be realistic and recognize that and not add to that panic. So we think we will obviously begin phase 2, and that will go for some period of time until there's a comfort level that we can safely begin summoning more people into the courthouse and in particular do jury trials. So you'll see in phase 4, we call it the new norm. Courthouse is pretty much open to all proceedings. We'll still try to minimize the settings. We'll try to eliminate as best we can large calendars to avoid just the interaction of people together. We'll open up the public areas again. Staffing will now go to 100%. But we will continue to monitor emissions. The report also emphasized during this phase we would strongly suggest that we not go back to the old ways just because we've hit these phases. We have been forced as a court and as attorneys to try matters that we've never had been able to do or never wanted to do in the past through technology and remote processing. We've found now that we can do them and we can do them well, and that even when we reach this phase, we should continue to the degree that we can to continue to use the electronic medium to handle matters. So those are the 4 phases. When we were done developing that, we said to ourselves, okay, there are 5 areas that people need to have some guidance in when they start coming back into the courthouse. So let me kind of go through some of them with you, but before I go there, let me give you a short kind of idea about phasing. Phasing 1, attorneys are let back in. Phasing 2, public is allowed back in. Phasing 3, incarcerated defendants return to the courtroom. In phase 4, we're back to the new norm and all proceedings can occur. So as I mentioned before, the courthouse entrance is really important, and what's going to occur there is really the focal point initially to make sure that our facility stays safe. We're going to have separate entrances for employees from the public, and there's going to be 6 feet social distancing that's going to be required as you line up to come into the courthouses. I emphasize that for those who have in the past come over thinking that at 8:45 they can make it to a court proceeding at 9 o'clock, at least for a while, I doubt that that's going to happen, because we're now not only going to have forced 6 feet social distancing, we're going to have additional screening that's going to occur. So you need to plan a little better. Face coverings are going to be mandated. So either a mask or some face covering you'll be required to have. If you don't have one, one will be provided for you and you'll be required to wear it. There's going to be a series of COVID-19 screening questions that are going to be asked of you. You'll need to answer no to them and to gain entrance. Your temperature is going to be taken at the entrance. We have purchased some scanning equipment to place at each of the entrances of each of the courthouses, so it'd be not the old you see on TV, people taking a handheld device and putting it to your forehead. This will actually be a computer scan that will tell us if you have a temperature or not. So if you answer yes to any of the screening questions or you have a temperature, you'll be denied entrance. If you have a court proceeding, the Capitol Police who will be doing the screening will take your name, what proceedings you were in for, and will notify the appropriate court that you have been denied entrance. The next group of the discussion subcommittee led was, now that you've gone through the screening process, you've been allowed in, how are we going to manage people within the courthouse itself? For employees, we have reconfigured their workspaces so they're going to be 6 feet apart. Like you, they're going to be required to wear a mask when they enter the courthouse or they leave their work area. In all public areas, so if you happen to go to the pathonetary's office and you want to do business with them, you're going to be talking through a plexiglass area. We're going to mark those 6 feet apart, so you'll be standing 6 feet from the people and you'll be talking through plexiglass. The one hot topic, particularly in Newcastle County, is the use of the elevators. In Kent and Sussex, it's not as significant an issue. Their facilities are not that large in the sense of having multiple floors. 2 or 3 floors is the norm. They're going to suggest in Kent and Sussex that you use the stairs as much as possible. For those who are physically unable to do that, we will obviously open the elevators up for those individuals, but it's likely that in Kent and Sussex we'll lock down those elevators. That's not possible to do in Newcastle County. So we have in the report set a limit of 4 people in an elevator. We had a lot of debate as to what that number is. 4 it does impose a risk, but we tried to balance the risk between that and trying to get people to the courtrooms that they need to get to. So they will be limited. We're going to try to have the employees use a different elevator that is behind family court, but the public and the attorneys would use the main elevator bank that's in the courthouse. We're going to also ask our employees the best we can, if they can, do their responsibilities remotely, that they would continue to perform that job remotely.
And Judge Carpenter, I think what we can say from the last 2 slides, both the front entrance and circulation within the courthouse, people are just going to have to be patient. Things are going to take more time. There's going to be limits on the number of people we can let into certain areas. So we're going to really ask the bar to be as patient as possible with us. It's for your safety, it's for our employees' safety, but there is going to be a bit of a slowdown in how we physically move around the courthouses. So we are thanking you in advance for your patience and hope you understand that when it inconveniences you, it's just out of safety that we're doing it. Thank you, Judge Carpenter.
Yeah, no doubt about it. It's going to take more time to get through the front. It may take you more time to get to the courtroom floor that you need to get to. But again, it's to minimize. The more people we have gathered together, the greater the risk. So we try to minimize that as best we can. We then turn to the courtroom itself, how we're going to manage it. Obviously, we're increasing technology at each of our courtrooms to be able to better connect with you, litigants, and particularly the Department of Corrections. So we will encourage our judges to continue to hold hearings and conferences by video and use the technology that's available. Courtrooms are going to have to be refigured to some degree. We're requiring that proper social distancing continue with counsel, litigants, and the court staff. That includes at least 6 feet from the jury and court staff. Now, we recognize, and the report actually recognizes that there are some constitutional issues involved, particularly in regards to client and attorney relationships that just do not allow the 6-foot social distancing to be reasonable. Certainly we recognize that, and the judges will be tolerant of the fact that there are just times you're going to have to sit next to your client and converse with them. But to the extent that we can, we need to try to maintain some social distancing, particularly with the jury and the court staff. That is going to be important.
And Judge Carpenter, as far as that communication, I think some of the law firms can start thinking about some technology solutions to communication if you want to maintain social distance. And I know the Office of Defense Services is thinking about that, and I think the law firms should be thinking about that as well. As how are you going to interact with your client in your courtroom if you're going to be socially distanced as much as possible? And that may require some walkie-talkie type devices. But the technology is out there, and these are things I think the law firm should start thinking about now.
And we use them today with the interpreters in the courtrooms itself. So that is something to kind of look at if you are considering that possibility. Here's a big change. We're going to ask counsel to stay at counsel table when they address the court. We just do not want everyone going to the podium, infecting the podium, and then the next person getting up and moving to the podium and being infected. So we're going to ask that counsel remain at counsel table when addressing the court. We're also going to try to develop some procedures that limit counsel's direct access with the clerk's office or clerk's staff in the courtroom. We're thinking about maybe putting a separate table on the side where people can lay the documents that they need to give to the clerk. The clerk can go over and pick them up. So you're not having to come right in front of the clerk to do that. Or we may even decide that after time we may have to put some protective glass up or between the court staff and you. But we're hoping to develop some alternatives so that we can at least keep the courtroom looking like a courtroom. We're also considering as we progress whether dividers are going to be needed between staff and you and litigants, and in particularly the jury, and how we're going to sit those jurors so that maintaining the social distances. A question often is raised by our staff as to what precautions they should take in regards to handling documents. As Dr. Bacon said, we think the most important thing is after the court proceeding, our staff wash their hands. We encourage you to do the same. If you feel uncomfortable, feel free to wear some protective gloves, but washing your hands is going to be key to that process. You're also going to recognize the next area we looked at was management of calendars. When you have multiple courts in a courthouse, we simply are not able to all do whatever we wanted to do whenever we want to do it. If we did that, there would just be way too many people in the courthouse at the same time. There would be too many people waiting for court proceedings. So each court is going to have to take a look at their calendars, spread them out, not do these large cattle call calendars anymore, and coordinate with the other courts. So again, we're limiting the number of people in the courthouse. It may be different times. We may, instead of having 200 people come at a time, we may do 20 people at a time and do them at different times throughout the day. It also requires some coordination of calendars, particularly in phase 1 and 2, because we're not bringing incarcerated inmates into the courthouses. So at least in CCP and Superior Court, we will be continuing some alternating days use of the video proceedings, but the capacity at the Department of Corrections is going to be greatly increased. And we're going to try to leave what is there now, the video phone world, available for ODS and whatever attorneys need to talk to those inmates, available for you to use, and not the remote facilities that we are going to utilize. Again, whenever reasonable, we're going to ask that we try to do everything through the technology. And I think you'll see a lot of that on the civil side. For those who handle criminal matters, we did look at the prison capability down in each of the lockups in each of the courthouses. The Department of Correction have calculated the number of individuals they can bring to the courthouse each day. When we hit phase 3, it is limited. It is not as big as it used to be. So those days of each of us saying, it really doesn't matter what the number is, tell the Department of Correction how many people we need that day and they bring them, not going to be that way anymore. We're going to have to come to coordinate with all our partners to try to minimize the number of people who are incarcerated downstairs in our lockups. We've also talked to them about transportation, how many people can be safely transported in each of their vans. The inmates' temperatures are going to be taken either at the facilities or when they arrive. If they have a temperature, they cannot come into the courthouse. They'll be taken back to the facility. If they have a temperature at the facility, they can't come. There's all sorts of procedures that have been established. If an inmate becomes known to become infected or is in close contact with someone who's infected, there's a process of notifying everyone. And that's true if one of you become affected and you've happened to have a proceeding with one of the inmates, a notification procedure with the Department of Correction. So those are the phases. I'll close by saying it is an interim report. We asked it to be designated that because we still need to work on solutions for jury selection. And the final area we're going to try to address is what happens if we are forced to close the courthouse again. There are obviously proceedings, including trials, that are going to have to be done because there are people, particularly in jail, who are awaiting their trial. So the committee is going to look at the worst case scenario. The virus can spreads tremendously again. We have to close the courthouse. What steps do we need to take now to actually do those proceedings in an electronic format? So that's my presentation.
Thank you very much, Judge Carpenter, and thank you for chairing the committee and for all the hard work that the committee members have done. Dr. Bacon, could you just share with us what you think are the responsibilities of attorneys who are going to come back into the courthouse, how they can do that safely?
Thank you. Well, I think what I'll be doing is reiterating what you've just heard and sort of make sure the science behind it is pretty clear. I think that mitigation factors are designed to reduce risk. There's no zero risk, but if you look at the risk of acquisition in the household of 11%, close contact at work 4.5%, you can decrease that risk by decreasing the volume of humans you're nearby, spacing out by 6 feet. Social distancing will be critical. And also minimize the individuals present in a room, particularly a well-ventilated room if possible. The data on wearing a mask is quite impressive. And the reason people wear masks, the science is that if you have COVID or are harboring COVID asymptomatically, the risk of transmitting it with a mask on you to an individual across the way is reduced at least by 60%. Some people think 80%. If both people wear masks, the risk is reduced at least 75% and maybe even down to 95%. So you go with social distancing, limiting humans, decreasing prevalence, and reducing your risk from 4% to 0.5% by wearing masks. Limit access, the numbers are important. If the prevalence of this virus in the community is 5%, which it's not, it was at one point probably, then for every 100 people coming in your building, 5 have COVID. Well, if it gets down to 2% and you limit the numbers, you'll have less than 1% of people in that building with COVID. That once again reduces that risk. Hand washing is critical. A simple issue, 100% efficacious in terms of destroying the virus. I use the Purell-based hand wash on a regular basis. I even use the alcohol-based fluids to clean off my face shield after leaving rooms very comfortably. 8 weeks, it's kept me pretty safe. Clean surfaces regularly. That's to be said, but surfaces are not a big provider of disease here. But frequently contacted surfaces are doorknobs, sinks, areas where the faucets are touched, the hand grips, etc. So those should be cleaned. Then the comment about gloves with objects is important. So keep in mind the personal responsibility you have as well. We all do in this setting of pandemic. Be conscious of your symptoms. Don't ignore symptoms. Don't say, well, I'll be fine tomorrow. You need to have the responsibility of saying, I need to protect myself and my colleagues. If I have a fever, if I have a cough, if I check one of those things on the questionnaire, which are true and new, it's a valid discussion that you should not be expose yourself to other humans. Social distancing, 6 feet, this is very appropriate. 14-day furlough goes back to the 14-day incubation time frame. If you're in contact with a person with COVID disease, you need to be scrutinized in some way, yourself or others, for 14 days. I've had a number of contacts, and I get daily texts from the hospital saying, "How are you today?" They're not warm and fuzzy texts. They're meant for a purpose, but they're appropriate. You have two hands. Wash them as much as you can. The adage of washing your hands, singing "Happy Birthday" twice is what we use in the hospital. You have one head. Use it. Don't touch it. That's really hard to do, and I appreciate that. But you really need to be conscious of that. When you sneeze or get rid of secretions, which all of us have an opportunity to deal with, into your elbow. The goal is to move you from that 11% household contact risk, close contact, 8% eating in a room with someone, to less than 1% outdoors, staying away from individuals as much as you can physically, wearing a mask, washing your hands are just the critical factors there. So I would encourage you to move forward with those thoughts in mind. Thank you.
Thank you, Dr. Bacon. Gail, why don't we turn to some questions that people have asked?
Okay, I'd be happy to. I will say the first one is for Judge Carpenter, and it is the question that was repeated here by several members of the bar. Do bathrooms count as public areas? Will the lawyers have access to restrooms in the courthouses?
I guess they are public areas, but they're not going to be closed. They will have access to bathrooms. We are going to put up signage requesting people to limit to 2 people in the bathroom at any one time. It's a self-managed. We're not putting a bailiff by the bathroom door and enforcing the 2-person limitations, but we're asking you to be reasonable and understanding that the more people that are there, the greater the risk. And so the bathrooms will not be closed, but there'll be some signage to try to limit their number of people that are utilizing them.
And remember that the number of people in the courthouse is going to be a lot smaller than people are used to. So hopefully it won't become a big problem. People should know that the cleaning program for the courthouses has been looked at carefully, and it's going to be appropriate to keep things as sanitary as possible. There's deep cleaning when we need it, and there's not just nightly cleaning, but there's cleaning during the day as well. So it's something that we've focused on, and there will be increased cleaning activity at all the judicial facilities.
Quite a few questions for Dr. Bacon. First, Dr. Bacon, would you be willing to share your slides? I think there's a lot of good information in there that the lawyers might like to use to talk to their staff.
Oh, that's a really good idea. I'm happy to have you share my slides. They're all public data, and they're just put together in a certain way, so I appreciate that. And I've sent them to Gail Lafferty, so perhaps she could disseminate them if desired.
And I will do that after this. A couple of more questions for you. Some indication that maybe 6 feet isn't enough. Do you have any comment on that?
I do. You know, when this 6-foot discussion came out, within minutes in the lay press, there are comments about 10 feet, 15 feet. A wonderful New England Journal paper describing the presence of the virus in air, even up to 3 hours later. That's not invalid data. The issue really isn't, is the virus in those environments? Can it be transmitted in that way? And you get outside 6 feet, the risk of transmission drops off dramatically. So 6 feet is in my mind the appropriate number. You'll see numbers all over the place by renowned experts, et cetera. But I think 6 feet is going to hold up at this point in time. That's a good question.
And some indication early on that there might be an immunity to it once you've had it. But I guess the USS Roosevelt, some of the soldiers got it again. Just wondering if you had any insight on that.
I appreciate that. And so number one, this virus can remain positive testing-wise in your nose for up to 4 to 6 weeks. And what you're detecting is not the actual virus living, it's the RNA, the dead virus RNA living in that area, not living, but residing in your nose. Prolonged positive tests are a problem we're dealing with now with many patients. So number one, you can detect the virus longer than you'd like to in the nose. You're not infectious during that time. Number two, can you get this virus again? I think that's unlikely. This isn't a really, I mean, intellectually, it's a fascinating virus. It has many phases. We're seeing an awful lot of individuals that are having a prolonged pulmonary disease phase, which goes on for weeks and maybe months. So I think that there may be some confusion of testing with those phases. And the last question is, so the answer, I think you can only get it once, by the way. So the last question is about antibodies and immunity. You know, every tenet of infectious diseases and immune status tell us that if you have a disease enough to generate an immune response and therefore an antibody, that antibody should protect you. There's some diseases where it doesn't. Lyme disease is one, by the way. But this disease, by all current judgments and data from CDC and based on DPH conversations even recently, suggests that antibodies will be present and they will likely be protective. And we're even using that theory in the convalescent plasma infusions of our patients now. So I think it will be a protective antibody. I think it's unlikely to get it again. I think that the antibody will be demonstrated at some point in time.
Fantastic. For Judge Carpenter, if an attorney is turned away with the temperature at the door, will they be placed on any kind of a banned list for a period of time? Or will they be allowed back in once they're symptom-free, if it's the next day? If they're otherwise asymptomatic.
Yeah, to some degree, we're going to rely upon the attorneys to self-monitor the system. Obviously, they won't be allowed back in if they continue to have a temperature. We're generally seeing that, I think the doctor can maybe verify this, at Christiana, that if somebody has a temperature, they ask them to monitor yourself for 7 days, and then if after 7 days, they perhaps can come back in if no symptoms have appeared. So the expectation would be that we would ask you to stay away from the courthouse for a period of time, at least until you're confident you have no symptoms that would reflect that you've been infected.
Yeah, I would add to that. I think it's the key comment you made was relatively asymptomatic. Well, there's no such thing as relatively asymptomatic. You have a fever, you're symptomatic, and that's all you need to be in that category of people that potentially have this disease. So there will probably be a time frame, and I'm not responsible for setting that time frame for you, where you'll want to have that individual monitored, watched. There may be a role at some point of testing when testing is readily available and capable of being adequately sensitive. I wouldn't comment on either of those issues right now, though.
Okay. Thank you. And also for Judge Carpenter, in the 10-person limit within the courtroom, does that include court staff within the 10-person count?
It does not. We have generally excluded court staff, the judges, and attorneys in that 10 number. We did that to give us some flexibility, so we're really talking about 10 not court-related individuals. So if your client would be included in the 10, the visitors behind would be included in the 10, but we're trying to give the courts some flexibility to say it does not include court staff or attorneys.
And let's be clear about that. Any judge in any proceeding can say, I don't like the way that the courtroom is operating right now. I feel like there are too many people for the size of the courtroom, or someone's uncomfortable. It's going to be completely up to the presiding judge to decide whether additional accommodations need to be made to make sure that everybody's safe.
In the report itself, it talks about the right of the judge to limit the number of people in the courtroom, to issue orders to that effect, to remove people from the courtroom if they're not wearing their mask or not obeying the orders that have been given. So there is some flexibility. The reality is, when you look at our courtrooms, getting more than 10 to 14 people in it is very, really hard, unless you get to the really large courtrooms. So really, regardless of what the number is, 10 is probably all you can do.
And that's a nice segue to talk a little bit about technology, which is our Judicial Information Center, led by Ken Kellerman, is working hard to bring video solutions into all the courtrooms. And there's a lot of creative thinking going around right now with JIC about how we can broadcast using Zoom, how we can put some civil proceedings onto YouTube. So stay tuned. There's going to be a lot of exciting news on the technology front about how we're going to broadcast proceedings outside of the physical courthouses.
And you actually anticipated my final question, Chief Justice. We're starting to run short on time, so I think I'll turn it back to you to wrap things up.
Thank you, Gail. And thanks everyone for the good questions. And sorry we don't have time to answer all of them right now, but we'll attempt to respond either by getting back to you individually or by posting some more information on a website. I want to thank Judge Carpenter and Gail Lafferty and Dr. Bacon again for participating today, especially Dr. Bacon. We know you're at the hospital. We know you're sleep deprived and have been working like crazy to take care of Delawareans. And I know on behalf of the bar, I just want to express our appreciation for the work you're doing at the hospital, and in particular to help people get through this COVID-19 epidemic. So thank you.
Thank you.
I also want to thank the Delaware State Bar Association. The Bar Association continues to assist with programming, and it's going to be a key participant in our transition to increased activities. I want to thank Court Scribes, who made this presentation happen so seamlessly. And please note that the Justice of the Peace Courts also have worked hard on a plan for increasing activity in their facilities. And that plan, along with the reopening committee's report, will be up on our court's website this afternoon. I look forward to seeing everyone on Skype for Business or Zoom or in the courthouses and judicial facilities as soon as public health and prudence permit. Thank you, everybody, for attending this.